Apple-shaped obesity can be seen both in men as well as in women. But pear-shaped obesity is seen only in women. Like వంశపారంపర్యంగా వచ్చింది, లేదంటే అన్నెసరీ అన్వాంటెడ్ ఎక్సెసివ్ ఫుడ్ తిని, లేదంటే జంక్ ఫుడ్ తిని, లేదంటే ఆల్కహాల్ మూలన కొంతమంది బియర్ బెల్లీ అంటారు. యాపిల్-షేప్డ్ obesity అనేది బియర్ బెల్లీ. Nowadays ladies also are having alcohol, so they also should develop beer belly. They also should have the same kind of features as men. Why this difference? This is something which doctors also have to ponder, as well as the general public also have to think about.
But considering general public, అందరికీ obesity అనేది ఒకటే తెలుసు. అందులో రెండు రకాలు ఉన్నాయని మాత్రం నాకు తెలిసి చాలా మందికి తెలియదు.
Medicines that have come, GLP-1 inhibitors and other things, like చాలా మంది Wegovy, Monjaro అని చెప్పి చాలామంది ఈవెన్ సెలబ్రిటీస్ హ్యావ్ టేకెన్ దోస్ ఇంజెక్షన్స్ అండ్ లాస్ట్ వెయిట్ అని చెప్పి ఇంత అడ్వర్టైజ్మెంట్ చేస్తూ ఉంటారు. బయాటిక్ సర్జరీ చేయించుకున్న వాళ్ళు కూడా 20, 30, 40, 50, 100 కిలోస్ లూజ్ అయిన వాళ్ళు కూడా ఉన్నారు. ఇట్స్ అ రియలీ కమెండబుల్ వెయిట్ లాస్ దట్ పీపుల్ హ్యావ్ అచీవ్డ్. వెయిట్ లాస్ అయిన తర్వాత స్కిన్ సాగింగ్ అయితే ఈజ్ కామన్ ఫర్ బోత్ మెన్ అండ్ ఉమెన్. బట్ ఇన్ సమ్ ఆఫ్ దీస్ ఉమెన్ హూ హ్యావ్ లాస్ట్ 20, 30, 40 kilos also, overall the upper body shrinks very well, but the lower body, that's the hips, thighs, legs or the arms, they remain the same or minimal sagging.
Hi, hello everyone. Myself, Dr. Mona, and I welcome you all to Med Talk with Mona at Omega Hospitals. ఈ మధ్యకాలంలో చాలా మంది, ముఖ్యంగా ఆడవాళ్ళు ఇబ్బంది పడుతున్న ఒకే ఒక్క, I don't say okay, but one of the important issue, weight gain. So పిల్లలు పుట్టిన తర్వాత లేదా certain age or menopause hit అయిన తర్వాత ఎందుకో తెలీదు, అంటే అంత బింజ్ ఈటింగ్ చేయకపోయినా, లేకపోతే ప్రాపర్ డైటరీ మెజర్స్ తీసుకున్న, రెగ్యులర్ ఎక్సర్సైజ్ చేసినా కూడా వెయిట్ గెయిన్ అవుతూనే ఉంటారు, లేదా ఆల్రెడీ వెయిట్ గెయిన్ అయిపోయి ఆ స్టబర్న్ ఫ్యాట్ని వదిలించుకోలేక చాలా ప్రాబ్లమ్స్ ఫేస్ చేస్తారు. ముఖ్యంగా ఈ వెయిట్ గెయిన్ వల్ల దే గో త్రూ బాడీ షేమింగ్. వర్క్ ప్లేస్లో కానీ, ఫ్యామిలీలో కానీ, ఫ్రెండ్స్లో కానీ ఎవరో ఒకరు ఫ్రీగా జ్ఞానిస్తూ ఉంటారు. ఏంటి ఇంత వెయిట్ గెయిన్ అవుతున్నావు, డైటింగ్ చేయొచ్చు కదా, జంక్ తినడం మానేయచ్చు కదా, వై డోంట్ యూ ఈట్ హెల్దీ, లేదా జిమ్కి వెళ్ళొచ్చు కదా, ఎక్సర్సైజ్ చేయొచ్చు కదా, అసలు ఏం చేస్తుంటావు డే అంతా అని ఫ్రీగా జ్ఞానిచ్చే వాళ్ళు చుట్టూరా ఉంటారు. బట్ డూ యూ నో లైక్ వాట్ ఎగ్జాక్ట్లీ ఇస్ దిస్ రియలీ అ కాస్మెటిక్ కండిషన్ ఆర్ అ మెడికల్ కండిషన్? ఏం చేసినా కూడా ఈ వెయిట్ లాస్ అవ్వట్లేదు అంటే ఇట్ కుడ్ బి సంథింగ్ సీరియస్లీ అ మెడికల్ కండిషన్. సో టుడే వీ హ్యావ్ డాక్టర్ Srinagesh, consultant plastic and reconstructive surgeon who is specially dealing with this stubborn fat surgical cases. So let's know more about this. Hi Dr. Srinagesh garu.
Hi.
It's a great pleasure to be here at Omega Hospitals. So you are a most well-known plastic and reconstructive surgeon at Omega Hospitals, right?
I don't know, maybe.
But I do. Okay, and many do.
No, thank you.
So the first thing is, ee madhya kalamlo, see, on being a woman, first I want to address one major issue most of the women are facing these days. చాలా మంది ఆడవాళ్ళు ముఖ్యంగా పిల్లలు పుట్టిన తర్వాత, లేదా వెన్ దే ఆర్ క్లోజ్ టు మెనోపాజ్ ఆర్ ఆఫ్టర్ మెనోపాజ్, కొంచెం ఏజ్ పెరుగుతున్న కొద్దీ డైటింగ్ చేసినా కూడా, జంక్ తినకపోయినా అన్నెసరిగా వెయిట్ పెరిగిపోతూ ఉంటారు. ఎందుకు పెరుగుతారో తెలీదు. సో చుట్టూరా ఉన్న ఫ్రెండ్స్ అండ్ ఫ్యామిలీ ఫ్రీ అడ్వైజెస్, హ్యాపీగా కావాల్సినంత జ్ఞానం ఇస్తారు. ఖాళీగా ఉంటావు, ఏం చేస్తావు, జిమ్ వెళ్ళొచ్చు కదా, అనవసరమైన చెత్త అంతా ఎందుకు తింటావని. సో ఈ వెయిట్ గెయిన్, ఈ స్టబర్న్ ఫ్యాట్ చాలా మెంటల్ ప్రెషర్ కాజ్ చేస్తుంది ఆ ఉమెన్కి. సో దాని గురించి మీరు ఏమైనా చెప్తారా?
షూర్. యాక్చువల్లీ ఏంటంటే ఇప్పుడు ఇట్స్ అ వెరీ గుడ్ క్వశ్చన్ దట్ యూ ఆస్క్డ్. నా వెయిట్ గెయిన్ అనేది చూసుకుంటే రకరకాల కారణాల మూలని జనాలు వెయిట్ గెయిన్ అవుతూ ఉంటారు. వన్ ఈజ్ ఓవర్ ఈటింగ్ జంక్ ఫుడ్ లైక్ మీరు చెప్పినట్టే. థర్డ్ ఈజ్ ల్యాక్ ఆఫ్ ఎక్సర్సైజెస్. ఫోర్త్ ఈజ్ హార్మోనల్ ఇంబ్యాలెన్సెస్. 5 is genetic. 6 is environmental factors. These all things, stress levels at work, all these things contribute to weight gain. And of course, any other metabolic diseases also, like diabetes, hypertension, thyroid, all these things also can lead to, fluctuations in the cortisol levels. All these things also can lead to weight gain. If you look at general weight gain అన్నప్పుడు, everybody thinks obesity.
Yeah.
Obesity లో వచ్చి ఏంటి, there are generally two kinds of obesity. Okay, one is apple shaped obesity antaru, second is pear shaped obesity antaru.
Oh, shapes in obesity.
Yes. So apple shaped obesity can be seen both in men as well as in women. But pear shaped obesity is seen only in women.
Oh.
Enduku? If it is genetic, if it is, like వంశపారంపర్యంగా వచ్చింది, లేదంటే unnecessary unwanted excessive food తిని, లేదంటే జంక్ ఫుడ్ తిని, లేదంటే ఆల్కహాల్ మూలన బియర్, కొంతమంది బియర్ బెల్లీ అంటారు. యాపిల్ షేప్ ఒబేసిటీ ఉంది, బియర్ బెల్లీ. Nowadays ladies also are having alcohol, right?
Yeah.
So they also should develop beer belly. They also should have the same kind of features as men.
True.
But these women have more of a pear-shaped obesity rather than a apple-shaped obesity or generalized obesity, as is classified in Harrison's Principles of Medicine. That's the standard, gold standard textbook of medicine for all doctors.
Yeah.
Okay. So why this difference? This is something which, doctors also have to ponder, as well as the general public also have to think about.
But considering general public, అందరికీ ఒబెసిటీ అనేది ఒకటే తెలుసు. అందులో రెండు రకాలు ఉన్నాయని మాత్రం నాకు తెలిసి చాలా మందికి తెలియదు.
ఓకే, సెకండ్ వచ్చి, ఇప్పుడు if it is a genuine obesity, then diet, exercise, medication, like even the newer medicines that have come, GLP-1 inhibitors and other things, like, చాలా మంది, Wegovy, Monjaro అని చెప్పి చాలా మంది, even celebrities have taken those injections and lost weight అని చెప్పి ఇంత అడ్వర్టైజ్మెంట్ చేస్తూ ఉంటారు. They should lose weight.
Yeah.
Plus bariatric surgery, standard procedure for weight loss. సో బ్యారియాట్రిక్ సర్జరీ చేయించుకున్న వాళ్ళు కూడా 20, 30, 40, 50, 100 కిలోస్ లూజ్ అయిన వాళ్ళు కూడా ఉన్నారు. ఇట్స్ అ రియలీ కమెండబుల్ వెయిట్ లాస్ దట్ పీపుల్ హ్యావ్ అచీవ్డ్. కానీ ఇఫ్ యూ లుక్ ఎట్ ఉమెన్ ఫోక్, వాళ్ళకి వెయిట్ లాస్ అయిన తర్వాత స్కిన్ సాగింగ్ అయితే ఈజ్ కామన్ ఫర్ బోత్ మెన్ అండ్ ఉమెన్. బట్ ఇన్ సమ్ ఆఫ్ దీస్ ఉమెన్ హూ హ్యావ్ లాస్ట్ 20, 30, 40 kilos also, overall, the upper body shrinks very well, but the lower body, that's the hips, thighs, legs or the arms,
they remain the same?
They remain the same or minimal sagging.
Okay.
Why is the big question.
Yeah.
Okay. This is because there is a special different condition, medical condition called lipedema.
Okay.
This lipedema is unfortunately poorly understood even by the medical fraternity, because of lack of research and because it occurs primarily in women, and WHO had not recognized this as a separate disease until 2019. It was not taught in the medical colleges.
But till date, most of them, like, they're considering this unwanted weight gain or stubborn fat as a cosmetic condition.
Yes.
Unlike a medical condition.
Yes, unfortunate. That is very unfortunate because of lack of research and lack of proper
Awareness,
scientific knowledge and awareness. Obesity is a disease. Similarly, likewise, lipedema is also a disease. Lipedema may have features of obesity, but obesity is different, lipedema is different. Both of them are totally different disease entities with different treatment protocols and different settings altogether. Clinical features and everything is different.
How do we recognize this lipedema before stepping into a doctor's cabin?
Very good question. See, usually these women who have lipedema, we have noticed that, right from puberty, this particular disease starts around puberty.
Okay.
or during pregnancy or during menopause. So, why does this happen? That is the time when there is a hormonal fluctuations taking place in a lady's body, right? So, that is the time when there is a estrogen surge, progesterone surge, ups and downs. These are the times when the lipedema fat, which is very sensitive to these hormones, start attracting these hormones and get activated and start to grow. And they grow in the hips, the thighs, the legs, and sometimes the arms and the forearms.
We address as unwanted areas.
Okay. So, the lower body, in other words, keeps on increasing. It's the disease of the extremities otherwise. Sometimes these people have, a lot of varying amount degrees of pain or tenderness. So, on pressure or while working, standing for long periods of time, walking for long periods of time, what happens is the entire body weight shows up on the legs and the thighs, and they start to become painful or tender.
Okay.
So, these people also have a tendency to develop spider veins or bruising, easy bruising. Without realizing, they hit something somewhere, and the next day they find that they have a bruise.
The greenish black.
Bluish, greenish, reddish patches, which heals over a period of time. Next is these people also can tend to develop, reticular veins or varicose veins earlier. And the fat, the skin which initially looks normal, slowly starts to change in texture because of internal fibrosis. The skin gets pulled inwards in an irregular fashion, and the fat, like an obese fat or normal fat, is not smooth.
Okay.
It becomes nodular or granular. So, it could be like pearl shaped or pea shape or rice grain type, or sometimes even a walnut size or a lemon size nodules, globules of fat.
So, these
So,
nodules.
the skin becomes irregular.
Okay. So, when it comes to this irregular skin, are these nodules like spread in closer distance, or like they are widely spread?
It
depends?
It depends. It is unpredictable,
Okay.
but the distribution is almost equal on both sides. So, the symmetry is maintained, but the volume of fat keeps on growing. So, over a period of time, they can start developing swelling of the legs. It's a connective tissue disorder basically, wherein there is a weakness of the lymphatic system and the venous system. So, these are all some of the classic features, and as the disease progresses, the volume of fat keeps on increasing.
So, if ignored, if all the signs and symptoms are ignored, what are the worst consequences to be faced?
Well, as the disease keeps progressing, as the fat keeps on depositing, like I already mentioned to you, they can develop varicose veins. I also mentioned to you that the lymphatic system is weak. So, there is a fluid collection in the legs, so which gives that heaviness, feeling of heaviness, and because of the heaviness, the woman also feels fatigued. And because of the nagging pain and that heaviness, the patient can go into depression. Because of the extra amount of fat deposits in the thighs, the legs get splayed out. When the legs get splayed out, the center of gravity shifts.
Yeah.
Okay. So, what happens is, if this is the knee joint, this is the center of gravity. Okay. So, this is the feet. So, the center, it goes down straight. Now, with the extra deposit of fat in the thighs, what happens? The leg shifts this way instead of being straight like this, right?
It starts tapering.
So, what happens? The center of gravity has
shifted.
The leg has shifted away from the center of gravity. because of the angulation.
Okay.
Okay, something like knock knees.
Yeah.
So, what happens is the joint which is supposed to be here gets aligned at an angle. So, there is a differential pressure on the knee joint. So, the inner part of the joint starts to
Glide.
rub against each other and they develop arthritis. Now, because the center of gravity is shifted out, means the leg is shifted out of the center of gravity, the feet at the ankle twists and the medial arch gets affected and slowly becomes flat. So, they tend to develop flat feet and walking becomes difficult for them. So, these are all a sequence of events, and when neglected, some of them can also end up with frank lymphedema, that is like elephant legs.
ఓకే సో అంత దూరం వరకు వెళ్ళకముందే ఇఫ్ ఆల్ లక్ ఆన్ ద ప్లేట్ దే స్టెప్ ఇన్ టు ద డాక్టర్స్ క్యాబిన్ వాట్ ఆర్ ద పాసిబుల్ ట్రీట్మెంట్ ఆప్షన్స్?
See, we first try out with some conservative methods like compression garments. Of course, we do ask them to go on a regular diet. Diet is very important, whether they like it or not, and whether it works or not. Because for lipedema, diet does not have a very big impact in weight loss. But diet has an impact because if you are taking an inflammatory diet, the symptoms become aggravated. But if you are taking an anti-inflammatory diet, the body cools down, the inflammation comes down. So, when you are having an anti-inflammatory diet, it also helps in reducing the inflammatory process of the lipedema, plus it also helps in weight loss from the obesity part of it.
ఓకే
Okay? Exercise. Exercise is very important. Some of these women, before we insist and tell them that go and do exercises, we must also tell them what kind of exercise they should do, and we also should find out, because some of these ladies, good percentage of ladies having lipedema also have features of Ehlers-Danlos syndrome.
Oh.
Now, what is Ehlers-Danlos syndrome? Ehlers-Danlos syndrome is a condition where there is the ligaments are very stretchy.
ఓకే
So, they have hypermobile or hyper-extensible joints. You must have noticed some of these people, they are very flexible,
Yeah.
like gymnasts.
True.
They can do all kinds of activities, they twist their hands, legs and all those things. Some of them are able to touch their
They can twist their
thumb
index finger to the- yeah.
or the index finger down to the hand,
Yeah, true.
the forearm. So, these kind of things. So, those people, because the ligaments are more stretchy, they should not do weight training looking at comparing themselves with others. Because if they take more weight than the joint can accept, they might go in for a dislocation or a subluxation of the joints.
It means they'll be given a fixed regime of exercise and diet to be followed.
Yeah, you should tailor your weight training exercises
ఓకే
accordingly. Next is the best exercises are walking, jogging, and the best by far is swimming.
ఓకే
For those who do not know swimming, have fear of water or something like that, they can at least walk in the water. They don't need to swim, at least walk in the water. These are very important. Next is compression garments.
I mean, like, what are these compression garments?
The compression garments is, there are, it causes some amount of compression on the limbs.
Okay.
So, that particular thing, it's like, some of these people, the men and women who have varicose veins or something like that, they are advised to wear some, tight socks.
Stockings and all.
Right? Similarly, they wear tight garments from ankle to the waist.
Okay.
Okay? So, what happens is, it helps in the upward pumping of the fluid which is collecting in the legs, causing heaviness.
Okay.
So, that as it goes up, the legs, that swelling goes, some of them get relief.
So for this compression garments, are there any time constraints like inta time vesukovali, it shouldn't exceed so and so time? Because few people before heading to office, they just put on everything and then head to office for hours and then come back.
Usually, compression garments are advised to be worn during the daytime when they are mostly sitting or standing
Okay.
or walking.
Okay.
And at night time, you remove the stockings when you go to bed.
Any permissible time limit?
You can wear it up to 12 hours
12 hours, okay.
at a stretch. But sometimes if you are feeling uncomfortable, you can just remove it for 15 to 20 minutes again and then wear them back again. There's no issues about it.
Okay.
So that is one. Next is, lymphatic massages. Lymphatic massages are different from the regular massages. The regular massages are more firm and they use more of pressure. Pressure may be good for the muscles, but is bad for the lymphatic system. So the lymphatic systems love cajoling. It must be, mild with very minimal pressure. So this minimal pressure massage actually opens up the channels and the drainage becomes more effective. Some amount of tapping may need to be done at the lymph node junctions, like in the popliteal fossa or in the groin or in the armpit or at the elbow. These are the areas where you need to, or at the neck. So to open up the channels so that lymphatic flow is more effective and efficient. Then comes the compression pump. Some of these people don't have access to a physiotherapist or an occupational therapist who is well versed with lymphatic massages. For them, we can also consider lymphatic pump. The next is, there's another method of stimulating the lymphatics is the vibration plate and the trampoline.
Okay.
So a vibration plate when used on a low mode can again stimulate the lymphatics. The sudden, the little jerky movements, in where you can position yourself, in different positions so that different parts of the body get stimulated. You can have a effective lymphatic drainage. When all of these fail,
all non-surgical methods fail.
Yes, these are all actually basically temporary methods, and these are things we see to if they can help relieve pain, because the ideal treatment so far as of now is a staged lymphatic sparing water assisted lipedema fat excision.
Okay. What is this lipedema fat excision? It's a complete vast surgical procedure or a minimally invasive procedure?
It's a minimally invasive procedure. It again depends on the stage of the disease and the volume of fat you come with.
Okay.
If you come, there are, now lipedema, if you look at lipedema, there are 5 types of lipedema and 4 stages of lipedema.
5 types and 4 stages?
Yes. Now, what are the 5 types? Type 1 is excessive fat deposition around the hips, the buttocks and the saddlebag areas. You find that the sides are bulged out like jockey's pants.
Yeah.
Have you noticed a jockey's pant?
Yeah.
It's bulged out in the sides.
And tapering downwards.
So that is type 1.
Okay.
Type 2 is a fat deposition from the hips to the knee joints.
Okay.
That is the buttocks, the lateral side of the hips and the thighs. The front, inner, outer and the back of the thighs. Then type 3 is when the disease goes up to the ankle.
Okay.
So you will find the feet are very narrow, even the hands are very narrow, very slim, but from the ankle or from the wrist you will find the bulge.
Okay. And type 3?
Type 3. Type 4 is the upper limb, that is the shoulder to the elbow or shoulder to the wrist. Again the hand is free, hand will be slim. Type 5 is from the knee to the ankle.
So only knee to
Only
ankle.
the knee to the ankle.
So no hips, no buttocks are
No
involved.
hips, no buttocks, no. So that is this, because there are, this particular thing is got 5 types. It also adds to the confusion in diagnosis of the patient.
Yeah. So when there is like generalized weight gain.
Yeah.
The
So in obesity, there is generalized weight gain, starting from the face till the feet.
Yeah.
You bloat up.
Plumpy face to
Yes.
swollen feet.
Yes. Bulky neck.
Yeah.
Heavy chest. Back rolls. Love handles. Beer belly.
A lot
Overhanging things
Yeah.
everywhere. All these things are obesity. But when you are seeing specifically that the upper body, the chest and the abdomen, especially the upper abdomen, is slim, whereas then it starts to grow on the sides. So it should trigger a alarm bell.
So high time to
No, so even if family, friends, or even the doctors are not able to diagnose, you should think that maybe it is different, and it is not the fault of the doctors also, because this has not been taught in the medical colleges even today.
really?
Yeah, because the awareness is very poor. So it is only now that the awareness is building up. This was initially diagnosed in 1940, however,
1940.
in USA.
Okay.
And then for almost 25-30 years, even USA, the lipedema treatment took a backstage. It was only in Europe, especially in Germany, this particular condition was identified, and some amount of research was done more in Germany, and more number of doctors there have been treating lipedema.
But considering the advancements in medical technology and this upcoming injections or bariatric surgeries, liposuction therapies, whatnot, everything, how safe are this and how many of them are still aware and not aware of this?
You see, you said bariatric surgery. Like I already mentioned to you, bariatric surgery works for obesity. It may help in relieving of some amount of pain and discomfort in a patient having lipedema as well.
Okay.
But it is not going to relieve of the lipedema,
Lipedema.
because lipedema fat is resistant to even bariatric surgical procedures.
Okay.
Okay, a patient might lose, X amount of weight and reduce in the upper body, but the lower body may not reduce. One more thing I would like to tell you is, a woman suffering from having lipedema has 2 types of fat. One is normal fat, the other is lipedema fat.
Oh, again.
Yes. So that is why when they use all these measures, they are slim on the upper body, or they shrink in the upper body when they go for treatment, regular treatment for obesity, but they don't reduce in the affected areas, lipedema affected areas. So it is very clear that there are 2 types of fat there. One is the fat that responds to diet, exercise, or medication or bariatric surgery, and another fat which is not responsive to diet, exercise, medication, or bariatric surgery. So it is this non-responsive fat, resistant fat, which we target, which is lipedema fat.
Okay.
So once we remove that fat, then the patient gets immense relief from pain, disability, and even the alignment of the legs change, and they get relief of pain, and they become more mobile, more agile, and they do their works more efficiently.
So once diagnosed with this lipedema condition, so how long will be the treatment procedure and the complete recovery to the normal form or shape of that particular patient?
Yeah, it depends again on the stage of the disease now.
Yeah.
Now, like I said, there are 4 stages of the disease. Stage 1, the lady looks almost normal.
Okay.
People will be confused if they say that they are diagnosed as lipedema also. Some of them, they will have a doubt because the appearance is very normal, but they will be symptomatic.
Like?
Symptomatic in the sense they could have spider veins, they could have bruising, they could have pain.
Okay.
Pain, unexplained pains, not responding to regular painkillers or the advice given by the neurologist. Because sometimes some of these pains, people go to the neurologist for, for these vague kind of pains, and some of them unfortunately are branded as functional people, and they are even asked to, some of them are asked to even go and meet the psychologist or the psychiatrist. So that is the kind of pain, because from the outside you cannot see any reason why they have pain.
True.
It's painful fat.
Because they seem
So
to
it's,
look normal.
yeah, lipedema is otherwise called the painful fat syndrome.
Okay.
So, if they are having this kind of symptoms, and when you feel the skin, the texture of the skin and the underlying fat, it may be granular or nodular.
Okay.
Then they can develop what is called the ankle cuff, knee cuff, or elbow cuff, or the wrist cuff signs, because the fat stops here. The fat stops at the ankle, and at the knee
All
or
the
at the
typical
elbow,
joints.
at the elbow joint, near the joints. So, you have the cuff sign. Then you look for what is called a stemmer sign. Stemmer sign is when you pinch the skin between the second and third toes, you must be able to lift the skin up like this. If you can lift the skin, then stemmer sign is negative.
Okay.
If you cannot lift the skin, then stemmer sign is positive.
Positive.
Okay. In people who they have lymphedema, sometimes this particular condition, lipedema, is confused with lymphedema.
Okay.
Lymphedema is a condition where there is abnormal swelling due to lymphatic collection. It starts from the feet and goes up to the ankles, knees, and the thighs. Whereas
Again,
lipedema, it is the opposite.
yeah.
Okay.
Many factors
And-
involved in
And
it.
it stops at the ankle.
Okay.
Until the last stage, the feet or the hands are not affected. So, so these are all the things.
Lipedema goes down and lymphedema goes
Goes
up.
up. Whether you can think it that way.
Yeah. But are there any chances wherein the treatment can fail in any
Yeah.
exceptional cases?
Before I come to this question, now let me complete the previous question
Oh, yeah.
about the treatment.
Yes.
Okay. As the fat keeps on increasing in size, then comes the stage 2, stage 3, and then the stage 4. As the fat keeps increasing, the nodularity of the fat increases, the volume of fat increases, the pain can increase, maybe inherently or on pressure. Sometimes when you run your hand also, you may feel a burning sensation and irritation, and the fat becomes nodular, there can be skin folds. So, these cases are lymphatic sparing, because the lymphatic system and the venous system is not very effective, like I told you in the beginning itself. So, while trying to protect those structures, we need to remove the extra amount of diseased fat. So, once we remove all the diseased fat, the patient has immense relief of the symptoms and becomes more agile. If the patient comes in the last stages, or when there's a lot of fat with lot of
In the
folds,
fourth stage?
yeah, late third and fourth stages,
Okay.
then the number of sessions also keep increasing, and we may also have to resort to excisional procedures like cutting off large chunks of skin along with the fat, and then resuturing, so we can give them a better appearance and better function, because these large skin folds in the thighs and legs and all those things, affects mobility, can cause rubbing of the skin in the developing, there's a fold like this, the fat falls on each other like this. So what happens is there could be moisture, sweating sweat collection underneath, and they form fungal
Lesions,
infections.
yeah.
Fungal infections, chafing, or even, the skin can cut through.
And if by chance they are diabetic, condition can get worse.
It can get worse. So these women also find it very difficult to go shopping, to buy proper clothes. The upper body may fit into a small size, whereas the lower body trousers may require XL, double XL, or even a triple XL. So usually they don't go shopping with their friends. They go shopping alone,
Okay.
because there's another issue of body shaming sometimes.
A lot of
these are all
women go
things.
through it.
Yes. So these are all the things, so earlier they diagnose, earlier they come for the treatment, the better the relief and better the quality of life.
Doctor, as you've mentioned, the treatment goes in a session wise. So the first or second stages need how many sessions, and the progressive third and fourth stage need how many sessions?
You see, we have to divide the body into the upper body and the lower body.
Okay.
Okay. Depending on the volume of fat, we have to, and the condition of the patient, we'll have to assess and tailor the number of sessions.
Okay.
Usually 2 to 3 sessions may be required for the lower body.
In a time span of?
That depends on the recovery of the patient.
Okay.
We don't fix a timeline,
Okay.
but a minimum of 6 to 12 weeks between sessions would be good enough for them to embark, so that they can finish the treatment earlier and be done with.
So once the treatment is done and the patient is back to like absolute normal form, healthy and happy, so are there any chances of recurrence?
Very good question. You see, fat once removed does not grow back.
Okay.
What can grow is the remaining fat in the body.
Okay.
Okay. Now, if you look at a person who comes for a traditional liposuction, we are not bothered about the lymphatic system or the venous system or something like that. We can go crisscross to get them a proper contour and shape. But in case of these people having lipedema, the fat is more nodular, different sizes, and is interlaced with intense fibrous tissue. So we have to address all these things while protecting the lymphatic system and the venous system, like I told you earlier. Now, when we do that, okay, we are trying to bring down the fibrous tissue, remove the maximum amount of this nodular fat, and get them a reasonable amount of shape. Okay. So all these things once done, usually for a period of 10 to 15 years, the remaining fat, even if it is going to grow, takes quite some time. Usually what happens is, the treatment is very effective, and most of the patients don't require a second session.
Okay.
But if the hormones are playing havoc, or if the genetic makeup is such that they keep on putting on fat in a more uncontrolled manner, then maybe 10 to 15 years is the time period after which they may require some small corrective procedures.
Okay, so once the surgical procedures or sessions are done, is the patient required to be on any certain medication or any diet restrictions or any other limitations?
Temporarily,
Okay.
medications temporarily, that is some amount of antibiotics, painkillers, and lymphatic flow improvement drugs. And these women with lipedema generally have some amount of vitamin D deficiency, iron deficiency, and B12 deficiencies.
Okay.
So we would like to give them those supplements, so that
Adding on supplements.
so once you give them those supplements, they improve. And of course, after the surgery is over, you may need to wear the compression garments for intermittently,
Okay.
not on a very regular basis.
So, are there any specific conditions wherein they are not allowed to go through this surgical sessions and then they don't have any other choice? Any exceptional cases to be considered?
Comorbid conditions.
Okay.
So if they have, a lot of sleep apnea, allergies, and if they have some cardiac conditions, such kind of things, then we need to get them evaluated by the concerned specialities, and then we can take them up for surgery. There is nothing called an absolute contraindication. These are all relative contraindications. So once those things are corrected, then we can take them up. The youngest woman a lady on whom we had operated is around 22 years.
Oh.
And the oldest or the most elderly person whom we have operated is around 84 years.
84 years.
Yes.
Great. So,
So age is not a barrier. It is the physical and the health condition that makes the difference.
so as we've discussed about hormones acting on this condition, so if they are down with any thyroid issue or any other hormonal imbalances which are really stubborn to deal with, so do we have to have a halt on this session? Let's say if 1 or 2 sessions are already done and the hormones are bombarding, they're not coming down to a control, maybe because of personal medical condition or any other issues. Can we move on to the other sessions of treatment or do we have to hold it on?
Usually when a large volume of fat is removed, most of these drugs which you have just mentioned, like thyroid or hypertension, diabetes, these medications are usually lipophilic. That
Okay.
is, the fat attracts these medications. The medicines get attracted to the fat and they get deposited inside, and most of the medications may not be really working on the disease. So if you are removing sufficient volume of fat, then the requirement of the medications will reduce. Second is the effectiveness of the medication becomes better. So sometimes if a sizable volume of fat has been removed, then sometimes the hypertension may get corrected, diabetes might get corrected, thyroid might get corrected.
So, or the hormones will be streamlined.
Yeah, they get more streamlined. Even your estrogen also might get reset.
The thing is, since the day the condition is diagnosed and for the treatment sessions and the complete recovery, it's a time taking procedure. So throughout this journey, most of the patients or most of the individuals, they go through some sort of taunting or free advices from friends and family, from known and unknown people and all. So obviously this is going to have an impact on their medical condition, right? I mean the mental health. So any advice on that?
You have to turn a deaf ear to them.
Do they really need a counseling? Because these
Yeah,
days most of them are fantasized for counselings.
Yeah. No, the thing is, we do ask them to meet our psychologists for a few counseling sessions, so they become mentally more strong, and they also have to gear up for to face all these things. Even normal individuals also face a lot of brickbats.
Yeah.
So these people are no different, and they should not consider themselves as patients. They are people who have a particular condition which, when addressed by proper counseling and treatment, can get better and lead a normal life. So they should not consider themselves as patients. I tell my patients after they come for surgery as well, they are not supposed to think of themselves as patients. So, and there's nothing like I'm a patient, I need to take bed rest and all the things. You have to be out of the bed around 5 to 6 hours after the surgery.
Oh. Just get back to normal routine.
You have to start walking.
Okay.
And get back into routine. So by 2 weeks or so, they can start resuming almost everything except going to the gym which we tell them to go after a month.
Mild activities are allowed after 8 to 10 hours?
Yes.
Okay.
They should start walking, they should start moving. Around the third or fourth day, they can even go to the kitchen if they want to. Yeah. And by the end of before the end of second week, they can even go to office. Driving is what we restrict for around 2 to 3 weeks.
Okay.
Gymming and exercise, we restrict them for 3 to 4 weeks. And after that, they're free to do what they want.
So, doctor, when the individual who's like burdened with overweight or stubborn fat, when they step into the doctor premises for the consultation, what are the first line of investigations you generally advise to rule out the diagnosis?
Now, lipedema is basically a clinical diagnosis. We diagnose them by their history and clinical findings.
Okay.
Okay. So far, investigations are not really very effective in diagnosing lipedema.
Not even a few?
There is hardly anything. The only thing is, we do some investigations to rule out other conditions, basically. Like we do a Doppler test to rule out varicose veins because they have pains and all the things in the legs. We do a Doppler test, one to see whether the varicose veins is the cause of pain or the lipedema fat is the cause of pain. Second is we can do a lymphoscintigraphy, but that differentiates, that's also for a differential diagnosis between lymphedema and lipedema. When we do a lymphoscintigraphy, we inject a dye into the skin at around the ankle area and look for how the dye is
Spreading across.
going up through the lymphatics into the lymph nodes up to the groin. So, how much time it is taking and whether the channels are effective or whether there are some lymphatic lakes, because these things are not very, very effective. You don't do MRI. We can differentiate between the muscle mass and the fat between the skin and the muscle. Okay. But the quality of fat, not all MRIs can, maybe some people, radiologists who have got special training or have taken special interest in this, they will be able to
figure it out what exactly
figure out.
it is.
Nowadays, they are saying DEXA scan could be useful in helping with the differentiation of normal fat with the lipedema fat.
Okay.
But so far, it is basically the clinical diagnosis, and this is another reason. These are, that reason, and the government has to identify that, lipedema is not a cosmetic condition but a disease condition, and it needs to be addressed. The insurance companies have to understand that lipedema is a disease and not a cosmetic procedure. You see, unfortunately, most of the times, many people think it's for cosmetic reasons.
Yeah.
The cosmetic benefits are a byproduct of the treatment done for correcting their problem.
It's an absolute medical condition.
Yeah, it's an absolute medical condition wherein people, general public, the patient, the general public, the government and the insurance company should understand, and they should include that. Yeah, they should include lipedema as a medical condition and not write it off as a cosmetic condition.
So, one last question.
Sure.
So, considering this lipedema condition, it's having an impact on ligaments, ending up with arthritis, and then varicose veins and all. How about its impact on renal system?
Usually, it has got no impact on the renal system.
Not at all?
No.
Okay.
So, because, now again coming to that, there are again two types of fat. One is the subcutaneous fat, the other is the visceral fat.
Yeah.
Okay. This particular lipedema is a disease of the subcutaneous fat, not the visceral fat. The visceral fat, like obesity fat, is normal fat which grows in and around the viscera, around the kidneys, around the liver, around the stomach, the omentum, around the intestines, around the heart. So this particular fat, the visceral fat, the best form of treatment for treatment of visceral fat is a proper healthy diet.
And exercise.
Exercise, of course, exercise does not have much impact on visceral fat as much as diet or bariatric surgery.
All right. So, thank you so much, doctor, for your precious time on Med Talk with Mona, for clarifying us all about what is a cosmetic condition and what is a medical condition, considering the stubborn fat in most of the women especially. So,
Thank you so much.